These young athletes from Swim Kids USA, who are also registered swimmers with the Desert Thunder Aquatic Club, know what it takes to work hard. The swimmers practice a couple times a week at the Chandler High School pool.
Every practice, about 30 minutes before they get in the water, I have the kids do dryland exercises to help them, get mentally prepared, physically prepared for their workout in the water. In addition to helping them prepare for practice, it also helps them enhance their performance in the water and reduce their chances of injury.
Chet Lake is one of the Swim Kids USA coaches. He knows how important it is for these swimmers to stretch before getting into the pool.
For example, if someone's form is off, they're likely activating the wrong muscle groups, which can be a problem in the water because if they're not using the correct muscle groups, that leaves them vulnerable.
We talked to Dr. William Patterson from OrthoArizona on some of the most common injuries swimmers can face.
As you can imagine, swimming is a very heavy sport involving the shoulders. And so there's two main problems that can happen in shoulder, and one of those is the imbalance between focusing on too much muscle strength in the front versus the back. And so what happens is the shoulder blade starts kind of getting a little bit out of whack, which can cause some pain. And then the other thing that can happen is swimmers tend to have a little bit too much mobility or flexibility in their shoulders. And so sometimes those can be a little bit tricky to treat, but fortunately rarely require surgery.
Paterson says if the injury doesn't require surgery, some treatment options include limiting your time in the pool, physical therapy, and stretching.
I am a big believer in stretching and warming up, but certainly there are certain cases where if you already have some looseness of your shoulder, you really don't need to be kind of stretching it to the degree that it's actually making the problem worse. So as opposed to the one keeping your arm straight and rotating your body, a better way of doing that is getting up against a wall where your arm is supported. Okay, so your arm is actually really supported on the wall and you can still rotate away, and this is really more stretching the muscles around the shoulder.
Patterson says it's also about taking a team approach when helping a young athlete get back to the sport they love.
I think probably the main thing really is education and knowing what to do and what not to do, and of course, the involvement of the parents and the coaches, trainers, physical therapists, making sure that people know exactly what's going on and that we have a very specific kind of treatment plan in place to make sure that actually is going to get better.